My name is Hallie Kretzinger. I'm a physician in the internal medicine group with Lawrence Memorial Hospital. I decided to become a physician probably for a couple of different reasons. My father's a physician, so I grew up around the profession. And then in high school and college, I was really interested in the sciences, and I wanted to do something where I thought I could have a meaningful impact with the sciences. And so that sort of led me toward the profession. Ultimately, my philosophy of care goes back to that prevention and management. So, I want to have a long-standing relationship with my patients where I can address their concerns and also, keep them up to date with the newest preventive measures as well as the newest treatment and management measures. And I just want to, maintain that trusting relationship so that they can rely on me and, have someone to go to when they're having issues over time. In terms of advice for patients, I think it's important to have a primary care physician. Even if you don't need to see that physician but once a year, if you're young and healthy, it's important to stay up on screening for different cancers. It's important to establish a rapport with someone who, if something would happen, you have somewhere to go. You don't have to go to the emergency department necessarily. You can come and get in the urgent care to be seen. So it's just important to have someone established. For people who are dealing with multiple medical issues, of course, it's even more important to have a primary care physician. If they do need to see a subspecialist, that can all be coordinated and choreographed, and then everything sort of consolidated and kept track of by the primary care physician. And I think it creates more balance that way. They have someone they can rely on and, someone with whom they can touch base with on a regular basis just to make sure that everything's being managed. What drew me to the internal medicine group and Lawrence Memorial Hospital was their focus on community. And both the internal medicine group and LMH are really interested in caring for people in the community, providing a place where they can go and they know they can trust the providers because they're familiar with them. So that was, I think, what really appealed to me was this notion of community everywhere I went with whoever I talked to. Just wanting to care for Lawrence and make this a local, it's a local business, but it also is very community minded. So that was really one of the things that appealed to me about the practice.